at back pain, you should not sit for prolonged periods anywhere. You are driving or sitting, you should not sit more than 1 hour. Because in the sitting posture, the pressure in the disc is almost 120 kilos, whereas the standing posture, it becomes 80 kilos. And when you bend forward, it becomes 160 kilos. So we can see that how bad it is. So prolonged posture is not good. So if you are driving or if you are sitting in the conference anywhere, after 1 hour just stand, you don't need to go anywhere, stretch yourself and sit back. That will increase the blood supply to the disc. And fourth important point to prevent the back pain or neck pain is forward bending. You should never forward bend. If you want to pick up something from the floor, you bend the knees and pick up, but don't bend the back. For example, there are two ways to pick it up. That is one way, that is back. And that is another way, that is bend the knees, keep the back straight, and pick up them. So that is a very important thing. So these are some of the issues which can give your neck and back a proper posture. Third thing is the proper posture. A lot of policemen, they just be like that in our service and they become hunchback. That is also wrong. So you got really, when you stand up like this to the wall, your buttocks, your heels and your shoulders and your head should touch the wall. That is a proper posture. If you do like that, every day you practice that, just stand to the wall and practice like that, you will get a proper posture. As you grow older, grow like that. The moment your head goes forward, that means 10 kilos on the head for every 1 centimeter you go forward. That means some people who are like this carry 30 kgs on the head without you realizing. That's why the neck spondylosis, all these muscles will be strenuous, and by evening the hands will pull and all the things will happen. So these are some of the things which we can prevent. Some people ask me, what is the type of bed we should use? There is no strict rule how to sleep, but there are some important orthopedic principles. For example, the bed should be firm, it should not be too soft. Probably you don't need to sleep on the floor. You can have a normal wooden cot, and on the top of the wooden cot you can have a mattress. You can have a mattress the way you want. You can have our good old, what you call cotton mattress, or you can have a U-foam, my-foam, but not more than 4 inches. 6 inches, 8 inches foam are not good. Because the moment you sleep, it will sag. The bed should not sag, it should be firm. So that is one indicator. And the second thing is lying down. Whatever the position you are comfortable, you can lie down. But preferable is the side. If you lie on the side, it is good. But if you are lying flat, always put a pillow under the knee joint so that your knees are bent. The moment you lie flat, the sciatic nerve gets stretched, and that can give you pain in the leg, especially if you are suffering from arthritis of the back. So that's very important. Some people like sleeping prone on the tummy, that's fine. In fact, that's very good for the back, if you got the habit. So these are some of the important postures of sleeping. Third point is, a lot of people will get the back pain day in and day out because of our traveling, because of our posture. Nothing to worry. As I said, only 1% of the back pain is to be worried, or even less than 1%. Rarely you will get a cancer in the back, and rarely you will get a tuberculosis in the back. These two things are the ones which you need to be worried. Whenever you got a back pain, you go to the doctor. We usually take one simple X-ray, which is 200 rupees. That will tell 99% of the problem with the spine. Sometimes, if the pain doesn't subside or if you are suspicious of something else, then only we will ask for an MR scan, not on a regular basis. Whenever you are having back pain, you are going to the doctor and the doctor is asking for MR scan and X-rays during every visit of yours. That means the doctor's brother-in-law has got a radiology diagnostic laboratory. So don't accept that repeated X-rays and MR scans. You don't need. What all you simply need is one base test. The third point is, for every back pain, neck pain, you don't need to visit the doctor. There are simple homegrown methods by which we can get rid of the pain. Any acute pain means suddenly you are lifting something, you felt a catch in the back. That is called acute pain. At that time, the treatment is the bed rest and the ice packs. Take ice cubes, wrap it around a thin towel and keep it on the back wherever it is hurting for 15 minutes each time. That is called tissue penetration time. And like that you do 3 times a day, your muscles will relax, and take any tablet like Combi-Flam, Brufen, you know the tablet. That will be enough. Usually in 2-3 days you will be out. Sometimes, if you don't take care of yourself, and especially you are lifting weight or pushing something, suddenly you catch the back, along with the shooting pain in the leg, that is serious. That is what we call a disc prolapse. That is the classical disc prolapse with the shooting pain in the leg. That needs immediate attention by the orthopedic surgeon. Then we will do an MR scan. Sometimes there will be a disc prolapse. Then we got to operate and take off the disc. And let me tell you, nowadays the spine surgery is very safe, very advanced, and very, very rewarding. So not those days where the spine surgery is very, very fearsome. Sometimes people can get paralysis. No. Nowadays nothing happens like that. That's right. Sir is telling about buccal minority who was operated by an English surgeon, and unfortunately he became a paraplegic afterwards. But nowadays it doesn't happen. If let us say 1 in 50,000 will have that complication. That much rare. And now we got what we call microdiscectomies. Now we got what we call microdiscectomies, whereby with the microscope we see that, and the incision is hardly 2 centimeters. We operate today, tomorrow you go for the disc process. Another point is that the spinal instability. That means that as we grow, especially for us, the audience in this room, the disc prolapse is rare once you go beyond 50-60. Disc prolapse happens in the younger age group when they are trying to lift some weight. But as we grow older, we get what we call spinal instability because of the arthritis. That means basically the spine in between, like a bricks, there is a cement, what we call disc. And those discs get degenerated. So the spine, instead of moving like that, it will rotate and create a torque. And that's why we get pain in the lower back for a prolonged period. Now they got very good operations in the spine as well, what we call spinal stabilization operations, whereby we put screws and rods in the back to stabilize that particular segment which is moving in a haphazard manner. So that's what we call spinal stabilization surgery, which again are very rewarding and very safe nowadays. So spine surgery has come of age and people get operated and get benefited. We got a massive spine center in our hospital, Sunshine Spine Center, where our spine surgeons operate almost 60 surgeries every month. And I think last week they operated on a patient who is 88, 90-year-old as well. So what I'm trying to say is the advances have come so much, properly indicated, even 80 plus, 90 plus patients also can get operated and get benefited. Gone those days where you say, hey, what happened? I'm now 70, no need. So, but the proper indication and proper selection and proper surgery are important. So for the back. Coming to the neck pain again, all of us, including myself, suffer from cervical spondylosis, which is one of the commonest things because we tend to read like, especially after the computers and the telephone texting, it has become worse. So as I said, always read like that. Even television, your television should be at eye level. It should look like that, not like that. Even while you are using the computer on the desktop, your eye level should be horizontal, not like that. Cervical spondylosis per se, again, our physiotherapists are here. They will show you some exercises. We got some sheets also for you, how to do the neck exercises. Simple exercise. If you do for 10 minutes a day, neck pain will disappear by 90% of the time. There are called isometric neck exercises, which they will teach you again after I finish my speech. And the neck pain with the arm pain is the serious one. Like the back pain with the leg pain, neck pain with the sternum arm pain is much more dangerous because these nerves come from the neck and those will supply the hand. Suppose if you got a neck spondylosis and you are driving a car, suddenly the car goes into a big pit in the typical Hyderabad road and suddenly your head jerks and you get a shooting pain on the hand, that's a serious matter. You got to see the doctor immediately because This is called brachialgia. That means the nerve which is supplying here got pinched up. Sometimes it can be fatal. It can be catastrophic. So you got to be careful of that pain in the arm. They are very rare, but these things should be taken care and should be well aware of. Coming to the next treatment of the back pain, some people use the lumbar corset, what we call belts. Belt is okay, no problem. You got to wear them from the waist below, and that will give you a proper posture and then give you support to the back. And as I said, there are some spinal extension exercises. Again, with the auxiliary which will show you to give you the patient. Some people ask me about yoga. The role of yoga is the pain in the neck and back. Yoga is good, but some of the yoga asanas are bad. For example, Vajrasana and Padmasana and part of Surya Namaskar are not good for the knee joints because they put tremendous pressure on the knee. The asanas which are good for the back are the asanas which take you backwards. It's called Bhujangasana, Dhanurasana, those are good. But at the same time, the asanas which go forward are not good usually because they put too much stress in the spine. So that is actually one of the important things. So in other words, the neck pain and back pain, I will summarize, they are not very serious. All the time you don't need to see the doctor. If you take care of proper posture, proper support in the chair, don't sleep for a prolonged period. Another important point is no Indian toilet at all. Some people still got the tendency of using the Indian toilet. It's very bad for the back, for the neck and the knee joints. Another important point is climbing up the steps. A lot of people think that step going up and down is good for the health. Yes, it is good for the heart and lungs, but bad for the back and the knee joint. Whenever you go up and down the stairs, 5 times body weight goes to the knee joint. So it's not generally advisable. Coming to the shoes, people keep on asking you what type of shoe wear and all. Always, whether you use a formal shoe or a sports shoe, the sole should be soft as much as possible. The sole should be, like say Nike, Reebok, Adidas, all these multinational companies produce a beautiful walking shoe where the sole has got a inner air pocket. So what in other words, you go to the shop and ask Nike Air or Reebok Air. So that means the sole has got an air pocket. So that means whenever you are walking, the whole impact is taken by the shoe, not by the body. Then walking, people keep asking again what sort of exercise is good for the body. There are 2 exercises which are uniformly and universally good for all parts of the body. That is brisk walking and swimming. These 2 are very good. Unfortunately, swimming is not accessible to many of the people. Brisk walking is good. And again, people confuse the brisk walking with jogging. Jogging and running are not good for a retirement age. Jogging and running are only when you have started running at a young age, develop your muscles, quadriceps and ligament, but not in the retirement age. People get good, feel good when you jog and get sweat immediately, but that's only a spurious advantage. The brisk walking for 10 minutes, jogging for 8 minutes is equal. There's nothing, no difference at all. Brisk walking on the soft ground, preferably let us say Brahmanandi Park inside, is good, where the ground should be soft. It is not preferable to walk on a cemented roads or tar roads or terraces. Again, because the micro impact will form on the knee joint and knee joints will get damaged. So preferably sports shoe and on a playground ground like the Brahmanandi Park, that's preferable. And then walking should always be like the signs of walking as well. When you walk, you should cross the hands like that, like that. Again, there is a science behind that. When you walk like that, there is a churning effect on the back, which will increase the blood supply to the disc, and so discs get a lot of nutrition, and so that is the way you walk. When you walk casually by putting the hands like this, it doesn't give you that much benefit. So the best way of walking is crossing the midline with the hands. That is very important. And swimming is very good for you. And some people ask about cycling. A lot of people have got a false impression that walking spoils the knee joint, which is not right. Walking increases the lubrication, but walking up down hill like Banjara Hills, Jubilee Hills might damage your joint. But walking on a plain ground will never damage the joint. Cycling again. Cycling is also good because it increases the lubrication. Nowadays, a lot of exercise cycles have come, which will give you a beautiful, they don't have a chain, they got a magnetic circuit. With that, you don't need to have the pressure on the knee joint. So again, cycling is a good exercise. But some people cannot take it because of the weak quadriceps. If that hurts, stop. And then cross trainer. Cross trainer is also a reasonable exercise. And when you go to the gym, you do whatever the exercise which goes into, whatever exercise hurts you in a particular part of the body, stop it. As simple as that. Coming to the knee joint, which is my specialty, knee pain is the commonest in India compared to all over the world. Because probably we squat right from the childhood. For every function we squat, we go and squat in the Indian toilet. So squatting is very bad. When you sit like this in the Indian toilet, 5 times body weight goes to the knee. So that has to be condemned. Like that again I told you the steps. And again in Andhra, going up and down Balaji temple, Tirupati by walk, again puts tremendous pressure on the knee. So these are some of the important things. So a lot of patients that come to me, I'll ask them, from next year, no Balaji temple by foot and no Ayyappa. Because these two are the ones which kill the knee joints. So knee joints are there for the people once you cross 50 to 60, the pain will start. The arthritis of the knee joint starts usually inside the knee joint, always inside. And slowly the knees goes like that. That is extreme arthritis when the knees get bowed like that. What we call arthritis stage 3 and 4. Usually arthritis of the knee joint starts with the morning stiffness. That means the morning, the moment you wake up, the knee joint will become stiff. And then pain when you go up and down the stairs. And sometimes the swelling can happen. And sometimes the sounds can happen, creaking sounds. So these 4 are the symptoms of the early arthritis. And again, arthritis of the knee is in 4 stages. First 2 stages, treatment is medicines and physiotherapy. Physiotherapy again, our people will show you the quadriceps exercise. Quadriceps is this muscle, what we call thigh muscle. It is the conglomeration of the 4 muscles, that's why it's called quadriceps. It is the key to this knee joint. I keep telling the patients, if the knee joint is Arjun, quadriceps is Krishna. So it's so important, without quadriceps, knee joint cannot work. And quadriceps development is very simple. They will show you the simplest exercise. Even while you are sitting, while you are in the office, by doing cycling of muscle, you can do that exercise. If you do that exercise 15 minutes a day, the knee pain will get down by 50 to 60% because the quadriceps will take off the load from the joint and joint will be offloaded. That's a very, very important exercise. And there are some tablets called glucosamine chondroitin sulfate tablets. Those are available over the counter in America. I'm sure most of you have had children in America. There are big jars like that, which are called rejoint, projoint, different names. But the ingredient is called glucosamine. And this is called chondroprotective. That means it tries to protect the strength of the cartilage. So you can take all of you can start taking that like a vitamin. Twice a day, glucosamine tablet, or you can get them here also in the medical shop. But of course, here we need a prescription, I think. And those are glucosamine tablets. Then calcium. People will again ask me a role of calcium in arthritis. Calcium does not have a role in arthritis. Calcium has got a role in the bone strength. The joint strength is different, bone strength is different. Bones need calcium. Again, calcium and vitamin D3 combination is very important for men also, but women it is much more important, and for the Muslim woman it is much more important because they wear burqa and the sunshine doesn't go into the body, which needs to convert the D3 to vitamin active particles. So men also suffer from osteoporosis, though to lesser extent than women. So you got to take again calcium 1 gram at this age group. That means 2 tablets a day. 1 tablet of calcium is not enough. So in other words, the baby aspirin is for the heart to prevent the blood clots. Like that, calcium also you take 1 gram. Many people again ask, you take more calcium, will it form kidney stone? No. Kidney stones are formed because of the genetic predisposition. Not every guy will have a kidney stone. And kidney stone form if you don't take proper water. The dehydration will increase the chance of the kidney stone. So calcium again you have to take regularly. Glucosamine if you take regularly. Do the quadriceps exercise and prevent sitting on the floor. These four are important points. When you go into stage 3 and 4 of the arthritis, the pain becomes worse. And again, as you said, the knees become bowed and what we call varus deformities in the medical parlance. And those two stages need operation or what we call knee replacement surgery, which is my bread and butter. We do around 3,000 joint replacements in Sunshine, which is the second largest center in Asia. The awareness is tremendously increased now in the knee replacement, and the strength and the success of the knee replacement is 98%. Again, as I said, like spine surgery, the knee surgery has become a very standard. Many VIPs and very important people of the Andhra Pradesh also got them done, and the success rate is 98%. That means a tremendous success rate in the medical science. And the new knee joints will last for 20 to 25 years without any problem. After the knee replacement, we can do everything. We can play golf, we can go on holidays, everything we can do. Nowadays, we got what we call high flex knees, whereby you can sit on the floor as well. So in other words, no lifestyle restriction if you got a knee replacement. In other words, whatever the body part moves, that part can be replaced now. You can replace the wrist joint, you can replace the elbows, you can replace the shoulder, you can replace the hip joint, knee joint, ankle joint, finger joint. As I said, any joint, whichever whatever moves, we can replace it with a new joint. So that is the advancement of science and excellent results can be obtained. So knee, neck pain and back pain are the commonest, and all of them can be prevented to some extent. And the treatment initial stages is very simple, rest of the part, exercises. And in advanced cases, surgery. And surgery is also very successful and rewarding surgery. So these are the general post-retirement orthopedic problems which I wanted to share with you. And I'll just close it off with the heel pain. Again, a lot of people, especially police force, have got heel pain. Especially during the initial years when you stand up, you get the heel pain. Heel pain is a very non-specific heel pain. Sometimes diabetes, sometimes thyroid can give us the heel pain. But heel pain is not a disease, it's a nuisance. It really creates a lot of annoyance for months together, sometimes years together. If you got a heel pain, the only way to treat that is to have a very soft silicone gel heel pad. There are heel pads available which are like a rubber. They are available in any medical shop. You slip them into the shoe and wear the shoe. And shoes should be always very soft. If you wear a normal shoe, go and ask for a shoe which has got a very soft insole. There are, for example, Clarks from England, Hush Puppies, Dr. Shaw's. These are some of the shoes which have got a very soft insole. So that is important. Even if you wear the slipper, always wear a slipper which has got a thick and soft sole. So those are the important things there. So these are the things, and I will be very happy to answer any questions. And before I close the talk, it will be an honor and privilege to have an association with retired police officers from a health perspective. That's what we were talking during the last visit. We are happy to provide you a privilege card which entices you to concession in the outpatient and inpatient tariff. And in addition, we will create a system whereby you don't need to wait in the queues and you don't need to run from pillar to post to get a proper treatment done. We will create a sort of one number or one window where you just ring them up and you will be taken care right from the arrival in the hospital up to the discharge. So Last time I spoke to sir, and we were very happy because it's an honor to serve the police or the military, because you all give so much and sacrifice so much to the society. So it is imperative on our part to pay back the respect to us. And so we will be very happy to do that, and we will finalize the nitty-gritty shortly. We will offer you a privilege card exclusively for you. And I asked sir to give us the name of the people who are ready to start that. Then we can create a card and we will give you a helpline and a hotline whereby you can reach us 24/7, one single number, and our people will take care. And we will build in some inbuilt concessions in the outpatients and inpatients depending on the disease. So that's what we intend to do. Thank you so much.